Good morning. I have my physician's order here. I have my patient, Miss Demetri Davis. She has no known allergies. Her date of birth is 4/11/95, and she's in room 303. She's gonna be getting furosemide 20 milligrams every 8 hours, IV push, and this medication is due at 8 a.m. And we're gonna be giving her 2 mLs over 1 to 2 minutes. So my medication, my physician's order do match. And this furosemide, it's gonna help with edema, and it's also gonna lower blood pressure. The usual dose is 20 to 40 milligrams, and it may be repeated in 2 hours. It also may be given undiluted. The rate of administration is each 40 milligrams or a fraction thereof should be given over 1 to 2 minutes. So we're gonna give 2 mLs over 2 minutes, so we'll give 1 ml every minute. Okay, with this medication, we're going to monitor my patient's labs, such as her bilirubin, creatinine, her potassium levels, because this is going to cause her to urinate. Okay, so now I'm ready to prepare my medication and perform my second check. Okay, and I have furosemide here in a 4 milliliter vial. She's getting 2 mLs, so we'll drop 2 mLs. I noticed that it's not expired. And this is the right medication for my patient, and I have my right medication. This is the right patient. It's the Demetri Davis. Their date of birth 4/11/95, and she has no known allergies. Okay, so I'm gonna go ahead and clean my vial for about 15 seconds. Okay, and let that dry. What I'm gonna do is now just draw my air. And I'm gonna draw 2 mLs of air. Okay, so I have my air drawn up, and we're gonna inject this air into the vial. And we're gonna draw up 2 mLs. And that needle kind of slipped and touched my hand a little, so in that case it would be contaminated, and I would get a whole nother needle and draw back my medication. Okay, and we'll use the scoop method to put our cap back on. And I do have 2 milliliters of furosemide, and what I do now is go ahead and label my medication. Okay, I'm gonna put my patient's name, today's date. I'm gonna put the time and the expiration date, my patient's room number. She has no known allergies. This medication is due for 8 a.m. And this medication is furosemide, 2 milliliters. And I'm gonna put my name because it was prepared by me. Okay. All right. Give me an extra antiseptic swab and put my label on my syringe. Okay. All right. I performed my second check, and now we're ready to go in my patient's room. Knock, knock. Hello, my name is Tiana. I'm going to be your student nurse for today. And today I'm going to give you some medication IV push, okay? Can you tell me your name and your date of birth? Okay, good. Can you tell me if you are allergic to anything? She states that she has no known allergies. Okay, Miss Davis, I'm going to be giving you some furosemide IV push. This is going to help pull any edema fluid off that you have. It's also going to lower your blood pressure. So anytime you need to get up and use the restroom, please let me know. If you start having any itching or burning or shortness of breath, just let me know, okay? We're going to continue to monitor your labs, your bilirubin, creatinine, and also your potassium levels. All right, go ahead and perform hand hygiene again. Okay, and I'm going to assess my patient's IV site. And I noticed that it doesn't have any redness or any inflammation or swelling, no infiltration. And I'm going to go ahead and load lower my bag, and I noticed that my patient, she has lactated ringers. Okay. Her IV site is intact and patent, and I'm going to check to see if her lactated ringers is compatible with my medication. Okay, and I noticed that it is. Okay, all right, so I'm going to go ahead and make sure this is unclamped, and go ahead and prepare to give my medication. She's going to be getting 1 meal every minute. It'll be a total of 2 minutes. First, let me go ahead and clean my port closest to my patient for about 15 seconds. Okay. All right, and we're gonna make sure this is clamped down. Okay, and we'll go ahead and take this needle off. Okay. All right, so I have that clamped down. Okay, and I'm gonna be giving over 2 minutes. Okay, I'm gonna go ahead and start. Right, and with my legs moving every minute, I will unclip the other line, take off my syringe, take the shots this time. I will observe my patient for any weakness, redness, swelling, signs of infiltration. How do you feel? Okay, patient says that they feel fine. I will. Okay. Already given my meal. Everything is unclamped and flowing. Patient is okay. I will be ready to document. I will document the patient's name, the name of the medication, the dose, the route, and the time. Okay. All right. We're gonna go ahead and unscrew this, and we're gonna dispose of this in the proper container. Biohazard. Okay. All right. Can you tell me how you feel, Miss Davis? Are you having any itching, burning, shortness of breath, or anything out of the ordinary? Okay. She says no. My patient's site is still intact and still patent. I don't see any problems. Are you having any pain on the scale of 0 to 10? Okay, good. All right, so Miss Davis, just make sure you get the call light whenever you need to get up and use the restroom. But other than that, just let me know if you need anything. My patient is in her bed is in the lowest position. Call light and reach, side rails up ×2, and that completes my push.